you can turn off your cameras as you wish, and then we'll turn them on again later. The next slide, please, Geraldine. So here are some basic instructions on: look at your mic, that it's off, raise your hand if you like to ask any questions. You can use the chat box, and you can also give reactions with what's happening at the webinar. So let's try to make it as lively as possible. So welcome all to, next slide, to this second webinar of this project to increase the capacity of the NGOs on preventive chemicals policies. This is part of a project funded by KEMI, the Swedish Chemicals Agency. And today we also have members from another project funded from the German Federal Ministry of Environment on improving the capacity of NGOs on SAICM. This is a smaller group, but they are also very interested in the topic. So here we are. So for today, we have asked, we think, the best speakers on these topics to join us. And we will start with this presentation, a presentation by Leonardo Trasande. He's professor of pediatrics. I think we all know him from well, professor of pediatrics in the Grossman School of New York University, Grossman School of Medicine, but we all know him thanks to his books and publications on environmental impacts on children's health, especially endocrine disruptors and other chemicals. And then we will have three presentations on initiatives to protect children's health from chemicals, from the EU, from Vietnam, and also at the international level. And then we will drop directly into discussion groups. We will have 4 discussion groups and breakout groups where we can exchange. And finally, we will come back and talk a bit about the next steps. So let's go directly to the first presentation. Dr. Trasande, you have the floor.
Great.
Please,
good morning or good afternoon, depending upon your time zone. Perhaps in this audience, I don't need to review all the reasons why kids are uniquely vulnerable to chemical exposures, but just to recap it in short shrift, children are more highly exposed because of their behaviors. They play close to the ground, they inhale more air, they eat more water, they eat more food, they drink more water, and their developing organs are susceptible because there are many systems that are just in development. We like to say you can't rewire a child's brain because when you have a permanent injury in early life, the consequences are permanent and lifelong, such as cognitive deficits and even autism and attention deficit hyperactivity disorder. And as we've increasingly understood the effects of hormones on our bodies, our natural signaling molecules that underlie every basic biological function, from good temperature, good metabolism, salt, sugar, even sex, we've appreciated that it's not only the dose that makes the thing a poison, that little things do matter. And in particular, we know that the effects of synthetic chemicals on the developing brain by hacking our hormones can be profound. So as a medical student and pediatric resident, I saw very early on the importance of doing newborn screening for checking a baby's thyroid hormone, because congenital hypothyroidism is eminently treatable. That's a genetic lack of production of thyroid hormone. But now we appreciate that it's not just gross dysfunction of thyroid hormone, and it's actually thyroid hormone function during pregnancy that's crucial for a baby's brain development, because the baby relies on mom's thyroid hormones through the second trimester of pregnancy. And the consequences even of subtle disruptions, these are things you don't pick up on a clinical test for thyroid function, can even be severe. Again, studies have shown that thyroid function in pregnancy, dysfunction, even subtle dysfunction, can produce cognitive deficits, autism, and attention deficit hyperactivity disorder. And we know that brominated flame retardants and pesticides can disrupt thyroid hormone and produce cognitive deficits. And this has been consistently demonstrated across multiple longitudinal birth cohort studies. And the implications of loss of IQ are not just substantial at a human level, they're substantial at a societal level. We know that if a child comes back with one less IQ point, I might not notice as a pediatrician, even parent might not notice, teacher might not notice, but if 100,000 kids come back with one less IQ point, the entire economy notices, because each IQ point is worth roughly 2% of a child's lifetime economic productivity. And if we estimate that a child earns, let's say, €1 million over his or her lifetime, that's 20,000 euro. And if you add that up on, let's say, 4 million children born each year, the implications are in the billions of dollars. And it's not just cognitive effects that we know that are due to these synthetic chemicals. We know, again, that hormones underlie every basic biological function you can think of. So just thinking about the obesity and diabetes pandemics, we appreciate diet and physical activity are the major drivers of those pandemics, but the fact is that synthetic chemicals are a third leg to that stool. And we know of 50 or more, we haven't tested all of the chemicals, synthetic chemicals that are obesogens, chemicals that literally make us fatter. To take an example of bisphenol A or BPA, it makes fat cells bigger. Bisphenol A is used in aluminum can linings and thermal paper receipts, if you're not familiar with it. But BPA, which has gotten so much media attention that I would doubt that would otherwise be the case, but BPA makes fat cells bigger, disrupts the function of a protein that protects the heart called adiponectin. And it's a synthetic estrogen. It can have sex-specific effects in body mass. That's not a thumbs up situation, even though Zoom seemed to pick that up as I enumerated those 3 examples. But just to use another chemical category of obesogens, the perfluoroalkyl substances, the nonstick chemicals, can disturb fetal growth, literally leading to smaller babies when they're born. But we know that when you contribute to growth restriction in utero, you develop what's called a thrifty phenotype, and your body maladapts to the environment outside the womb. And ultimately, you gain more weight and resorb that as fat. And ultimately, that can set you up for a profile of adverse cardiometabolic profile with long-term consequences for even heart disease in adulthood. And indeed, these PFAS, the nonstick chemicals used in oil and water-resistant clothing, as well as cooking materials, are associated with increases in childhood obesity. And the list goes on and on. This is a talk about children, so I won't focus on adult effects too much, but the fact is that adults are also highly susceptible to these effects. In fact, life is a window of susceptibility to these synthetic chemicals. We also know that chemicals can disrupt fertility, and the consequences of these synthetic chemicals for fertility are not just for the couples trying to conceive and have a baby. Subfertility or low fertility can actually be a marker of consequences for a child's long-term health once they're born, because there are effects on the gamete or gametes that propagate, because the gametes are single copies of the genome, and that genome gets essentially photocopied, if you will, to use a poor analogy, as replication occurs and cell division occurs, and the embryo becomes a child and then an adult over the lifespan. And it's no secret that we also appreciate there are consequences of these chemicals for even certain childhood cancers. We know that synthetic chemicals can contribute to leukemias, and indeed we've seen an uptick in lymphocytic leukemias, in particular in serial measurements of the population. So having gone through all the health effects and alluded to some of the economic consequences, when you look at the costs of endocrine disrupting chemicals, it's no surprise that the majority, if not nearly all, the 90% of the costs in the US and in Europe and across the world are due to effects of these chemical exposures in children. So in Europe, it's 163 billion euro. That's 1.2% of the gross domestic product. In the US, it's $340 billion a year. That's 2.3% of the gross domestic product. And that difference already reveals an adage I like to communicate in these kinds of presentations, that policies predict exposure, exposure contributes to disease, and disease ultimately costs the economy. When you really look at the origins of the difference in the US and European costs, the story is based in the use of flame retardants in the United States many years longer than Europe did. And that's because we had a California law that required them to be added to meet a flame retardancy standard. And so we've had a generation of Americans, and North Americans for that matter, that have much higher levels of flame retardants than in Europe. And so the costs in the US, mostly due to cognitive deficits, are $282 billion a year. And in Europe, it's $9 billion. Now, for the Europeans in the audience, there's a bad story for the EU in that when it comes to pesticides, we actually did the right thing in the US and added an additional safety factor for children in the Federal Food Quality Protection Act. And so the costs of pesticides in the US are $47 billion. Europe was more delayed, and the costs are on the order of $121 billion. So it's not simply a one-sided story. But again, that reinforces this message that if you look at levels across the globe, they vary substantially because of the regulatory and policy frameworks that are involved, and particularly those that affect children the most. So what can we do about these exposures? So clearly, there are safe and simple steps we can all take to limit these exposures in our daily lives. We can avoid canned food consumption because those linings have bisphenols in them characteristically. We can eat organic, which is proven to reduce pesticide levels in low income as well as high income populations. We can recirculate the air with the outside air in our homes and avoid accumulation of persistent organic pollutant dust that gets into our bodies by inhalation or ingestion. And we can avoid microwaving or machine dishwashing plastics because the chemicals used in plastics are not covalently bound necessarily to the plastic, and those chemicals absorb into food and into our bodies. But the fact is that there is a limit to what we can do as individuals through those safe and simple steps to reduce these exposures. And we need policy frameworks that proactively protect children from these chemical exposures that contribute to disease and disability. And ultimately, we need a number of steps to screen chemicals for their toxicity much more proactively, particularly with respect to the endocrine system. There remain substantial gaps which have implications for protecting children. We do have data gaps that are severe and significant, and we need a more comprehensive global framework for evaluating endocrine disrupting chemicals. In a series of papers we published last year in Lancet Diabetes and Endocrinology, we described the need for an international agency for research in endocrine disruption, or IARE. For those of you who are familiar with the UN, the WHO's International Agency for Research on Cancer, or IARC, you'll get the idea. But the point for those who are less familiar is that we need a framework to systematically evaluate and come up with evidence evaluations for these synthetic chemicals and their effects on the endocrine system that can ultimately be unbiased frameworks to support policy action and protection from these synthetic chemicals. I also want to emphasize that particularly in the low and middle income countries, we have very little data about these exposures, period. And we need better biomonitoring frameworks to support policy action and support the right to know when chemicals are being used in these products so that people can take the steps that I've described to reduce exposure. So I'll stop there. I look forward to your questions and comments in the breakout rooms. And thank you for the opportunity. And I'll go ahead and turn off my video. Thank you.
Thank you very much, Leonardo. So I think we have 5 minutes if we want to, if anybody has a question for Leonardo now, and if not, we will go to the next presentation.
Shall I share my screen, Dolores, or are you sharing from Geraldine?
As you wish.
As you wish, yes.
I can actually do it. That's very easy.
Okay, so thank you, Natasha. She's our next speaker. Natasha is Health and Chemicals Program Lead at the Health and Environment Alliance at HEAL. We all know it by HEAL. HEAL is, well, Natasha will present us a bit of HEAL now, but I think it's the organization that is really looking after the protection of children's health, specifically here at the EU. So the floor is yours, Natasha. Thank you very much.
Thank you, Dolores, and good afternoon to all. It's a pleasure to be with you. I won't say much, but just for those of you who don't know us, the Health and Environment Alliance is an alliance spread across the entire continental Europe, so that goes beyond the EU, and we work on bridging the gap between health and the environment. We are working on shaping European policies on environment and getting them implemented in a health protective way as much as possible. And as part of that, of course, there's a big chunk of work on chemicals. So I've been asked to share with you some thoughts on how the EU is acting to protect children from hazardous chemicals. And I have to admit that I realized as I was preparing for this presentation that there's a lot to be said. So bear with me, this could be the topic of a 2-day seminar. And I think what I will try to do today is just share some hints with you on what I think are relevant thinking points when we approach this topic, because there's really a lot to be said. Maybe to start with, it's relevant to understand that the protection obligations that the EU has towards children, they really stem from the foundational texts that we have in the EU. We have the Treaty on the Functioning of the European Union with an obligation to protect human health. And then we have sectoral legislations on chemicals, but also beyond, which most of the time also have this protection obligation. Now, as you well know, I think you're all involved in the details of the chemicals reality. The devil really is in the detail. And that's particularly true when we look at how the EU approaches chemicals management in relation to children. So I won't have the time today to cover everything I wish I could cover, but there are a few things that I wish I could at least get across today. The first thing is that it's very important to understand that there is no coherent definition and approach or references to children's protection across legislations. That will vary from one to another. And that, to me, is actually very much the foundational pitfall of the entire approach and the weaknesses that we see in the daily reality of actual legislation implementation. Another very important point to understand, and we won't have the time to go into the details of it today, but I think it's worth mentioning, is that the risk assessment processes that precede every legislation that we make on chemicals today is mostly not accounting for children's vulnerability. When you look at risk assessment models that regulatory agencies use in Europe, most of the times they're using rather conservative models that are based on assumptions that would work for healthy adults. But the whole aspect of children's vulnerability is not really well taken into account. Another important thing, and I think you will realize as I move forward in the presentation, is that the legislative framework we have is not really fit or in tune with the reality of how a children is being exposed throughout their life, but also throughout the day to chemicals. There's a very high focus on products and very much on certain products in the way they are used at a tea time. But that doesn't really reflect a lifetime exposure. Adding to that, and I think Leo sort of opened the gateway for me to say that I think it's also important to bear in mind that failures that we see for children's protection very much reflect failures that we see for overall chemicals management in Europe. The important point, though, is that the failures we have in chemicals management today in Europe are impacting children disproportionately. And in that regard, I think the example of how we deal with endocrine disrupting chemicals is very relevant. A last point, which I won't go much into details in the next slide, but I really wish to mention, is that we see a number of emerging challenges at the moment, which are particularly relevant for children. One is the whole development and the boom of the circular economy, and the fact that we find increasingly toxic chemicals making their way into products through recycling. So we did some testing where we found, for instance, brominated flame retardants being used for contents of plastic toys, for instance. And that with the boom of online sales, we also see more and more products getting onto the market that are not in compliance with safety obligations in Europe. And that is often the case actually for toys and plastic toys. So this is a part that I won't detail too much, but I still wanted to mention because I think they're interesting to keep in mind when we talk about children's and chemicals. Now, I mentioned, sorry, this is not working. Yeah, I mentioned when I started the presentation, a lack of coherence in the approach to chemicals for children. And in fact, if you're trying as an individual to understand how the EU deals with children in chemical, likely you're going to look a little bit like this little boy that is really confused. And the reason for that is that we do have an approach that's very much spread across different pieces of legislation, which I mentioned earlier are very much based and focused on specific products, which are used at a tea time. So all of those different initiatives, be it a Toy Safety Directive, the general directives that we have in Europe that's there to ensure the safety of products, they all deal with and are relevant to the exposure of children to chemicals, but they are not really in line with each other. The definitions are not in line, the models are not in line, the approach to regulation are not in line with each other. So if you're trying to get the big picture, it's actually very confusing. Another example of the lack of coherence I was mentioning before is when you try to understand how the EU approaches the protection of children to a specific chemical or a specific families of chemicals. And I think in that regard, the bisphenol A example is also really interesting. As some of you might know, in Europe, we have had a ban on bisphenol A for baby bottles since 2011. But at the same time, in the EU, bisphenol A is authorized for use in food packaging at lower and lower levels, thanks God, but still, it's still authorized today. And that does count food packaging that might be used or manipulated by children in home. So that's a very clear example of discrepancy. Another example of discrepancy is that sometimes some countries might take a more protective approach. So that's the case of France, for instance, which has a national ban on bisphenol A for all food packages. And that is not in line with what's happening at the European level. So I'm just mentioning this as a hint of, again, this lack of coherence that the EU has for one chemical, but also more largely for a family of chemicals that we know or suspect have harmful properties. I'm mentioning here, of course, the other bisphenols, because we know that bisphenol A is increasingly being replaced by other chemicals. So the reason why I mention those two examples, and I think the reason why they're interesting to think about is that they're really sort of highlighting some of the aspects I mentioned before. Even if you take very specific products, such as childcare articles, what you realize when you dig into EU laws is that at the moment, they are not properly defined and not properly covered. What you will find is measures on baby bottles. We'll talk about pacifiers. But for instance, there is no comprehensive legislation at the moment on, for instance, playground recreational equipment, clothing, bedding. Most of those discussions at the moment, they happen through discussions on standards, which in fact involves the private sector. Another aspect, which is also interesting, and I think relates a lot to what Leonardo was mentioning before, is that at the moment, the reflection around the exposure of children to chemicals is very limited. As I said, it is very product focused. But if you look at all the period of early life of a child or the exposure during the mother's pregnancy, at the moment, it's not being dealt in a comprehensive way. And yet we know this is really a key development period of a person's lifetime. So we can see there are lots of pitfalls, loopholes, and also some missed opportunities in the regulation opportunities that we have. I will mention one as a specific example because we've been working a lot with the EEB colleagues on it recently. As part of the REACH system, we do have an opportunity in Europe to put together restrictions. And recently, the French authorities have actually tried to put together a restriction on harmful chemicals in single-use diapers. And I think this is a really, really interesting example about some of the pitfalls that I was mentioning earlier. The situation was as such. In 2019, the French authorities carried out market controls on their market. And what they found is that the single-use diapers that were sold on the French market contained harmful chemicals, which are well known, dioxins, furans, formaldehyde, PCBs, in levels that were high enough to trigger concern and make them want to actually take regulatory action to stop this situation. So because France is part of the EU, France decided to propose an EU-wide restriction, which started being discussed at the level of the EU Chemicals Agency. From the time the restriction proposal entered this regulatory pipeline, the restriction proposal, let's say, started being undermined and ended up being completely downplayed by the scientific committees at the regulatory agency. And this, through this process, very much reflected a conservative approach to the risk assessment, as I was mentioning before, with the fact that control data from the French authorities were downplayed in the discussions around toxicity. was also the fact that because the manufacturers didn't include the chemicals in an intentional way, then the agency decided that you couldn't make a case for the risk to be widespread. So we end up in the situation whereby at the end of 2021, so more than 2 years after the actual control, the agency gave a negative opinion to the restriction proposal. The substances can still be found in the diapers. And now at the beginning of 2022, it's up to the European Commission to decide what they will do with this restriction efforts. So we as NGOs have been, of course, trying to push the authorities to support this restriction because we think it's very much needed. It's a clear, opportunity to protect a very vulnerable part of the population. So that's what we're working on right now. I'm putting some links, and we've been working on letters and outreach materials. So please, any opportunity you have to disseminate, do so. But maybe to finish this presentation with a bit of hope looking forward, some of you might know that since 2020, Europe has a new comprehensive strategy in relation to chemicals, the EU Chemical Strategy for Sustainability. And this strategy includes very specific commitments with relations to the protection of vulnerable groups, including children. So there's a general protection commitment, and there's also a commitment to actually improve the level of safety of specific products that children might play with or come into contact with. So this is a very good opportunity, and there are, in fact, for the year 2022, important milestones in terms of getting those commitments into a reality. So that includes the commitment to come up with a restriction on childcare articles. I was mentioning earlier, at the moment, we don't have such a restriction, so that's something we very much look forward to. But also commitments to revise the general regulations that we have, REACH, the General Product Safety Directive, which could really do with a little bit of a lift up to protect children better. So I think you understood my point about lack of coherence, definition and approaches. I think the last thing I would want to say, and maybe are the two most important things to go away with, is that to really increase children's protection in Europe, of course, we need to come up with a coherent approach to their vulnerability, but we also need to understand that the question is absolutely impossible to differentiate from a general upgrade of the EU chemicals legislations. So that's all I wanted today. Wanted to say just one last thing is that if you're interested in the topic, I put in the reference an excellent study that was put together in 2017 for the European Commission on vulnerable groups and protecting them. And I really recommend it as a read. It's very clear. Thank you.
Thank you very much, Natasha, for this thorough presentation. You already have a couple of questions in the chat if you want to answer while I present our next speaker for today. This is Mrs. Huang Hai. She is director at the Research Center for Gender, Family and Environment in Development from Vietnam. And she will be presenting us the International Lead Poisoning Prevention Week, where they have an awareness campaign on preventing the exposure of children to chemicals. So thank you very much, Hai. The floor is yours.
Thank you very much, Ms. Dolores. And good morning, good afternoon, and good evening, everyone. It depends on the time. My name is Phương Hai, Program Officer at CGFET, which is short for Research Center for Gender, Family and Environment in Development, which based in Vietnam, Hanoi. And today is my honor to be here to share with you the brief reflection about the International Lead Poisoning Prevention Week that has been carried out by CGFET in 2021. And the purpose of the week is to raise the awareness of the community, especially the decision maker and the media worker, about the risk of the lead poisoning and how to protect and urging to protect the children from chemical risk. Here we focus on the lead in decorative paint and surface at home and the kindergarten. Firstly, I would like to introduce a brief about the International Lead Poisoning Week campaign that was carried out in Vietnam by CZFET since 2017. And the aim of the week is to raising the awareness about the health effect of lead exposure. And we highlight the efforts of the countries and of the organizations of CSO and their partners to prevent the lead exposure, particularly in the children. And the third purpose of the week that was raised by the WHO was to urge the further action to eliminate pain through the regulatory action of, at the country level. And in Vietnam, the campaign, the International Lead Poisoning Week is a annual communication and advocacy campaign that was conducted by CZFET in the last week of every October since 2017 till now. And the campaign has been implemented by CZFET under the financial and technical support from the IPAN, maybe via in the project or in separate funding. And in this slide, you can see some of the image that we have conducted the International Lead Poisoning Week since 2018, 19, and 20. Next slide, please. And in 2021, we have been conduct the week within the last week of October, from 24 to 30 of October. And in this year's campaign, firstly, we have developed a fully action plan for the week. However, you know that due to the breakout of the COVID-19 across the country of Vietnam, some of the activity we have planned to conduct initially that has not been implemented directly as planned. Maybe even some of the activity has been cancelled due to the COVID-19. For example, we could not organize the painting event for the children that we intend to create to organize an event for the children to use the safe paint product in collaboration with the local with a local paint producer who is interested in the participate into the project's lead safe paint certification program raised by CZFET to carry out the event. And we cannot set up the meeting with the local policymaker to introduce and to briefly report about the study that has been conducted by CZFET and IPAN about the lead concentration in the decorative and decorative paints in and industrial paint that has been sold in the market in Vietnam, both online and offline. And also we cannot organize the seminars that announcing the research results or the events to promote for the week. Of course, it is a pity for our campaign, but we have tried to overcome the challenge and difficulties to continue the week by applying the online methods, like we use the research results and finding to continue our advocacy activities, such as we sending the open letter providing the key research finding and the results, as well as the key message. With the local policy maker like Vina Chemia, this is the Department of Chemical under the management of the the Ministry of Industry and Trade in Vietnam. And also we send the open letter and the report to the VPA, that is the Vietnam Association of the Printing and Paint in Vietnam. And additionally, another activity that we have more focus on is to carry out the mass communication activity via the mass media and social channel. Like we use the Facebook channel, we produce the media kit, including the media information, and including produce a set of poster with the together with the policy brief in Vietnamese that has been developed and delivered to the mass media agents and the journalists in Vietnam. Next slide, please. In this slide, in this following 3 slides, you can see that we have used some of the poster that has been produced and delivered by the WHO on the website, and we use the resource of the materials to translate into Vietnamese and deliver to the mass media and promote in our online communication program. Next, please. Next slide, please. Yeah, this is also another poster. Yeah, and this is also the poster as well. Next slide, please. Next slide, please. Yeah, in this slide, I would like to highlight some of the outcomes that we have reached through the week of this year, and as I said about the difficulties we have faced with due to the pandemic, and even though by promoting the communication online and the online method, we have produced the 2 reported that has been broadcast on the Vietnam National Television channel on 2 different TV channels on the screen that you can click to watch if you later on. And we have produced 11 articles on the e-newspaper that disseminate the research results and disseminate about the information of the week, and 7 of which that has focused on the risk of lead exposure among the children on their title. And this shows that the issue allows attention of the media journalists as well. And this week has been conducted under the support of the project of advocacy on lead paint in Vietnam. And in next slide, you can see the list of articles and newspaper that has posted in our website, as well as about the International Lead Poisoning Week that has been produced by the e-news newspaper in Vietnam. Due to the time limitation, I do not have a chance to show with you the television reported, as well as we do not have budget to translate and to make the subtitle of the report it in English. But if you want, you can watch on the directly on the television channels, e-newspaper of the Vietnam television channels to watch about the campaign. And that was about my brief presentation about the International Lead Poisoning Week that was held by CIFET. And hopefully in this year, we can continue our follow-up the study and about the lead concentration on the paint growth and surface in home of the children who were subject to our blood testing in the study that we have conducted in 2021 and 2022 and 2021 to have more evidence about the effect of the lead poisoning for the children's health from the decorative paint that used in the households. Yeah, thank you very much, and we all of your comments and questions are welcome in the next part. Thank you very much.
Thank you very much, Hai. Just to tell you all that the slides will be shared afterwards through our Teams channel, so you have there all the links that already Natasha and Hai have shared in the presentations, and also contact details, so you can contact them in case you want to know more about the campaign. For example, all the materials that have been produced in Vietnam, as Hai has presented, may be very interesting. So let's go to our final presentation. Natasha, if you hear me, you have a question there regarding HEAL in the chat. So if you can please look at it. They're asking if there's if HEAL is also working in Africa. And now I hand over to Alexandra Catterbo. She is co-director of HAY Support, and she will give us a short overview of initiatives at an international level.
Thank you, Dolores. Yes, hello everyone. Yes, I'm Alexandra Catterbo, as Dolores just said. I'm a co-director of HAY Support together with Olga Speranskaya, and we work a lot on international level at international policy processes. So therefore, I'm the one today to provide to you some information, just 5 minutes, about international initiatives on children and chemicals. So here you see that there are, like on the right-hand side, some obvious policy processes like the Stockholm Convention that bans a number of persistent organic pollutants that are also being used, for instance, in textiles, like flame retardants in some textiles. Yeah, there was a specific, for instance, a specific regulation in the US for flame retardants in pajamas for children. Then we have the Minamata Convention that seeks protection from adverse effects of mercury. Here also children are affected. And then we have other initiatives that are currently coming up that also have a relation to children's health, like an initiative to achieve a global ban of HHPs, especially being pushed by some of our NGO colleagues. And then there is an initiative to achieve a global plastic agreement. And yeah, as you know, UNEA is coming up soon, and we hope that there's gonna be a resolution deciding that an international negotiation agreement will be put in place, international negotiation committee will be put in place, So it's obvious a global plastic agreement, we think, should also deal about the health effects of plastic, and especially on children. So we don't know yet if this can be achieved, that something like this is going to be included, but we definitely think it should be included. And then there is SAICM, the Strategic Approach on International Chemicals Management. You probably heard already that the mandate of SAICM has ended in 2020, and we are in the middle of negotiating a new SAICM, or SAICM beyond 2020, which is very much a sleepy process at the moment, because there are no in-person meetings taking place, which halts the whole process a little bit. SAICM is a non-legally binding multi-stakeholder policy processes, and it always was also a forum to bring new issues on the agenda. And so here on this slide, you can see a little bit of a summary of all of SAICM. And on the right-hand side in yellow, you see I listed emerging issues or issues of concern that we very much hope and push for, that they are going to be also be taken up or continued in a future SAICM. And I highlight that those that are like very much connected to children's health. So we already heard in the previous presentation about lead in paint, but there's also a working group on EDCs, which is unfortunately also very quiet at the moment, because everyone is waiting for the new process to start. And then there is a working group on chemicals and products, which I will give you a bit more information on that in the next slide. Then highly hazardous pesticides and PFAS. So we really hope that these emerging issues will be taken up, and even more will not be like just discussion forums, but really get like smart targets and a good mandate, so that actual work, implementation work, and capacity building work can be taken in these issues or regarding these issues of concern. And we also go one step beyond and demand that these issues of concern will be like lifted to a higher level of obligation if they fail, or if they do not achieve all the targets. So this could be something on a more higher legally binding level. And on the SAICM Chemicals and Products program, here you see the 3 information objectives. So one is about transparency along the supply chain of products. We know that a lot of, not all of course, but a big portion of the exposure of children comes through products that they use, or that are being used close to them, or in indoor. So indoor air is a problem. And so this chemicals and products working group was trying to work towards this. There is a very good paper for NGOs, and who is part of the steering committee. The chair is Sweden, and then we have civil society representatives, and the one for us as NGOs is Olga Speranskaya from Hay Support. And yeah, if you ever have questions about this, drop her an email. And yeah, in the industry sector that send representatives, or that were focus sectors, are textiles, automotive, electronics, and toys. And this is why it is also very interesting in regarding the topic that we discussed today. yeah, as I said, if you want to know more, I only have 5 minutes, but if you want to know more about this, just email us or put something in the chat. We are more than happy to answer questions or discuss with some of you further. And also in our breakout group, I think it might be coming out there. So thank you very much. I hope I stick to the time. And yeah, so thank you very much.
Thank you very much, Alex. All of you stick to the time, so it's you're extremely obedient. Thank you very much. So we can go now to the breakout groups. I just wanted to remind you regarding the issue of chemicals and products that during our first webinar, we actually had Olga presenting that topic, and in the Teams channel, we have the presentation. So you also can find there more information. So now we will divide so we can all exchange and ask questions. So you just have to click on the my message in Spanish says unirse, so join message, and you will go to a breakout group. See you in half an hour. I hope you had nice discussions in our group. There was a lot of proposals for sharing information. So Leon, I want to tell you that Leonardo will share a presentation and also some studies and materials, and we will share them through the Teams channel with all of you. So perhaps we can go directly to the next steps, Geraldine. And before going to the next, well, I forgot at the start of the presentation today, of the webinar today, to present myself, but I think you all know me from the last webinar. I'm Deputy Policy Manager on Chemicals at the EIB and coordinating this project. And I wanted to present you to other two women who are working at this project. My colleague Geraldine Borja, please put on your turn on your screen.
Yes. Well, hello everyone.
So now you have a face to the women that are the ladies that are sending you messages, and also to Andrea Anca, who is our new comms officer, who will be helping with the communications in this project.
Hello everyone, very nice meeting you.
Okay, so now we can go quick to the next steps. So as I mentioned before, finally we have this Teams channel working. I would like to know through the chat or with any reactions if you have had any problems now, or if you can access this channel, because we want to be sharing the materials through this system. So I hope you don't have problems, but if you have, please tell us, and we will try to solve them as fast as possible. Geraldine has been very busy with this, and we hope it has, the main issues have been solved. Then, well, we will continue with the thematic webinars. This has been the second. The first one was on transparency on chemicals and products. You can find already in the Teams channel the presentations from that webinar and some additional materials. And if you want to discuss any issue regarding that topic, you can just open a discussion, and then the others can jump in, the presenters from that session. And the same with children. You will see that we have a channel for chemicals and children, where we will be sharing the materials and open discussions. And for the next topics, the next topics that you indicated in the survey at the starting of the project that you were most interested on were PFAS and evaluation of chemicals in the EU. But perhaps we will run a short survey with you to find out if these are the topics you want us to work on in the next months, or if you prefer others. So we will send you a short questionnaire or survey or ask you through the teams. Then we are planning a face-to-face meeting. We have budget for that, for covering your travel costs, and we have been delaying this due to COVID. The COVID situation did not allow us to organize with sufficient safety a face-to-face webinar with people from all over the world. We hope that this will be feasible in the autumn, and we will keep you informed about this as soon as possible, because you would need to organize your travels, and well, we would support you also with organizing that. So the next slide, please. So the next step in our campaign is to increase now the advocacy capacity. So we will start workshops to increase the advocacy, the campaigning capacity. And we have, after consulting with several of you, the topic that seems to have most interest and most potential for a joint campaign, to learn by doing a campaign, to learn to campaigning by doing a campaign, is a campaign to stop the exports of toxic chemicals from the EU to the rest of the world. This is a compromise of the European Green Deal that the EU will stop exporting chemicals that have been banned in the EU due to their toxicity. But it's there on the paper, and now we should make it a reality, and this requires an NGO campaign. So you will hear more about this. We would like to have a kickoff workshop in March, and again, you will be informed through the Teams channel. And then I would ask Andrea to explain a bit our comms capacity, our activities to increase the capacity on communication. Please, Andrea.
Yes. Hello, can you hear me?
Yes.
Okay. Once again, hello, everyone. The idea is to create a forum for discussion and exchanges and learning at the communications level. For that purpose, I'm going to send you a survey, a communication survey about your capacity. Just we would need to know what is your capacity for communications. I imagine some organizations have more of a capacity of a communications team, others have less or none. Nevertheless, I think all of you do communicate about your work to the outside world, and this is because this is a very important aspect of the policy work, communication. I think it would be, it seems useful and intuitive to create a forum in the framework of the CHEMI project for discussing communications. So I will send out a survey to map the skills that you have and the needs that you have, and hopefully based on that we will get hopefully we'll get enough feedback from you to be able to plan and schedule upcoming events online and offline for these discussions, for these exchanges, and also for trainings according to your wishes as well, according to your needs. So please, by all means, don't be surprised if you get this survey from me, and by all means do answer to it. Let me know if you have any questions. Otherwise, this is it from me for now. Thank you.
Thank you, Andrea. I see Anthony has his hand raised.
Yes, thank you. Thank you very much for the update. Now, I just wanted to reiterate, in the last, I think one of the very first meetings we had, that you tried to identify in breakout rooms what part of what Alex tried to do are these, and that we express a strong lack of capacity in terms of funding for us to be able to implement some of these activities locally in country. And in the next step update you gave, I didn't hear anything about, because I know you had said that you are also trying to fundraise to be able to support us in implementing some activities locally. So I didn't hear anything in that regards in your next steps update. So maybe you can just clarify and shed more light on that, because it's one of our critical needs. Thank you.
Thank you, Anthony. Indeed, I should have included it in the presentation. Unfortunately, we haven't been successful yet in funding and finding additional funds for funding activities at the local level. We keep trying, but nevertheless, we should already include as a priority, perhaps a workshop with our colleagues working on fundraising, to have also capacity building on how to prepare a project and how to fundraise. I think this is a priority issue for all of you, and we should tackle it already as soon as possible. Okay, well, just what is left is to thank all of you for participating and in this capacity building project. We hope this webinar was useful for you, and let's keep in touch through the Teams. And for me, it would be good afternoon, good evening for Hi and Ram, and good morning for others. Well, have a nice week.
Thank you very much.
Thank you very much. Bye-bye, everyone.
Thank you
Bye.
very
Thank
much.
you.
Bye bye, everyone.
Good
Bye.
luck. Stay safe. Bye.
Mm.